Welcome to KRQE's New Mexico News Insiders, 2025 Regional Edward R. Murrow Award winner for Best Podcast. Here's Gabrielle Burkhart and Chris McKee.
So, Gabby, we did not note the occasion, but our Insiders podcast, it did hit the 4-year anniversary mark back in October. Did you get the card in the mail?
I did not.
Okay.
You sent me a card?
Still in the mail. Yeah, it got lost. I'll blame the mail carriers, I guess. But really the reason why I bring that up, though, is how our podcast started 4 years ago. And what was the point of starting that when we launched in October 2021? This is something we've talked about with our guests a lot of times off mic, but not really on here.
Our origin story, for those who aren't familiar, was out of the COVID-19 pandemic, actually. We were doing a ton of Zoom interviews, and I felt like people just really were craving context to the headlines. Things were constantly shifting. People wanted to know what's going on, who's making decisions when, and I started just publishing our full-length Zoom interviews on our website, and I roped Chris into, hey, let's turn this into a podcast, because I think this can be useful to add context to the headlines.
Certainly, and we have evolved from there, and I think another place where we have evolved from is COVID, and that era back in what was 2021, but obviously COVID started the year earlier. Here now in 2025, I think one of the most memorable things I look back at is in terms of the healthcare infrastructure or our buildings back then in 2020. In some ways, the pandemic, I think, was a moment when New Mexico got the biggest snapshot it had received in a while of just how many hospitals we have, what's the capacity, what facilities we didn't have.
Yeah, since then, some things have obviously changed with New Mexico's healthcare infrastructure, arguably with UNM Health and its various medical facilities. So out of the pandemic, UNM has seen a building boom. That's what we're calling it. And that's what we're talking about today. Yeah,
and let's bring in our guest here. He is the Executive Vice President for the University of New Mexico Health Sciences Center and the CEO of UNM Health System, Dr. Michael Richards, joining us. Doctor, thanks for being here.
Well, Chris and Gabby, it's great to be here with you, and congratulations on the 4-year milestone.
Thank you.
Thanks,
We've been a long way. For
yes,
sure.
We appreciate you coming on because there's a lot we want to talk to you about. But let's just start. You've been leading UNM Health System as CEO since January 2025, so about a year in that role. We know UNMH is the state hospital, the only level 1 trauma center in New Mexico, the teaching hospital in New Mexico. But just kind of a broad bird's eye view, how would you describe UNMH to people?
Well, UNMH is an important part of the Health Sciences Center, but I really like to think of it as our health system. And so UNMH is our flagship hospital. It's actually a collection of multiple hospitals. It's our adult hospital, it's our pediatric hospital, it's our adult psychiatric hospital, it's our pediatric psychiatric hospital. But it is the state's primary teaching institution, not the only hospital that participates in teaching healthcare professionals, but the main one.
Yeah. And what does it mean for New Mexico? I mean, it's the centerpiece is what it feels like of health care. Is that fair to say in your view?
Well, I like to think of our UNM health system as being a part of everyone's health system. We're a public entity, and our job is to make the health of New Mexico better. And one of the ways that we do it is through teaching and through research and innovation. And the other way is we do it through delivering clinical care. All three of those things kind of fit together. But we should, and are part of everyone's healthcare delivery system. Like if we teach healthcare professionals, they're not just for UNM, they're for Presbyterian and Loveless and Christus St. Vincent. So our job is to help make them the best organizations they can be.
I want to highlight a little bit of your background. Before you got to your current role, you were UNM's Senior Vice President for Clinical Affairs and Interim Dean at one time of the UNM School of Medicine. You're a professor too, though I'm not sure entirely how often you're teaching these days, but maybe fill us in on that. But just to give it a little bit more, you served as the chair of the Emergency Medicine Department as well as being a former chief of staff at UNM Hospital. Previously, you worked as a paramedic firefighter and an EMS administrator, I found online as well. Where are you from? What got you interested in medicine? Did I get all those elements right? And why stick around here in New Mexico to keep pursuing medicine?
Well, great job. Yes, that's a pretty good summary.
Okay.
I've had a really interesting career at the University of New Mexico. I've been here about 25 years as a faculty member, and I trained here. And that's actually what brought me to New Mexico. I'm originally from North Carolina, but New Mexico has an outstanding emergency medicine training program. And I, after medical school, I came for that opportunity. And then had the chance to join the faculty. Now, you pointed out that I was a paramedic and an administrator prior to going to medical school, and that's what kind of created an opportunity for me to do some of that work as a faculty member and partnering as a medical director at the New Mexico Department of Health.
Yeah, and why stay here?
Well, because New Mexico is a special place, and so there are more opportunities here to do the kinds of things that I was interested in than in almost anywhere else. Now, early in my career, I was very interested in disaster medicine. And one of the things that folks may not know is that New Mexico was and still is one of the national leaders in disaster response. We have a Center for Disaster Medicine that was started by Dr. Paul Roth, who was one of the predecessors for me. And so the New Mexico Disaster Medical Assistance Team, which is part of the National Disaster Medical System, was actually one of the most deployed disaster teams in the United States and the very first National Disaster Medical Team deployed.
Wow.
What kinds of disasters would they get deployed to? Just give us an example.
Yeah, mostly these are domestic disasters, which turn out to be hurricanes and floods and fires, but also other kinds of disasters. And so there's been some international disaster response. So, for example, I got to deploy to the Haiti earthquake as part of our disaster team earlier in my career.
Yeah.
Wow. Yeah, so we want to talk about the building boom that we've dubbed it for UNM Health's medical services. There are a few components, but a lot of different projects you guys have going on. So we have at least 4 Albuquerque area-based projects that are either done or on the horizon. These range from community health to teaching facilities. Without getting into specific projects just yet, what was the catalyst for some of these building projects for UNMH?
Yeah, so we really are fortunate to be able to say that we're building infrastructure that's allowing us to create access to care. And the catalyst is New Mexico needs this healthcare infrastructure. We often talk about workforce needs, and those are the people, but people in healthcare work inside of healthcare infrastructure. And our state is behind on healthcare infrastructure. So it's great to be a part of helping build some of that healthcare infrastructure where we can take care of patients.
Right on. I want to start with the biggest investment, I would say, and likely the most public-facing investment for UNM, but correct me if I'm wrong. I'm talking of the critical care tower, though. This is a 9-level facility that's now home to many, among other things, the new adult emergency department and a large intensive care unit. It's where most, if not all, of surgeries are taking place in the UNM system. It opened on October 5th. What's happened in the months since then? What has the experience been like? And is it really like a mission accomplished in terms of setting out and doing what you wanted to do?
Well, it certainly is a big milestone. It is great to be in that new healthcare facility. It offers up modern spaces for our clinicians to practice medicine. It's environments which are very friendly to patients and family, and it's the kind of facility that New Mexico needs.
Yeah. Is it, been an experience where you've had trials and tribulations, ups and downs? What have been the things that you've heard out of that facility so far?
Well, moving into a big $842 million building that's that size, it comes with a lot of challenges. There are some growing pains to be able to occupy that space. If you think about it, we on October 5th, we occupied it. It started at 5 o'clock in the morning, and by noon that day, it was in full operation. And so all of the staff and all of the providers had brand new space to work with. but it was brand new space for everyone to work with. Yeah. And so it's taken a little bit to get up to speed, but I'd have to say that folks are very excited to be in that building and to have that as the infrastructure to support the care.
Yeah. It's certainly no simple undertaking to just flip the switch and one day you're working from one space to literally the next, where regardless of if it has everything's maybe in slightly different places. It works a little bit differently.
Well, I have to say that the planning to move into that space actually went on for a couple of years. Yeah. If you think about moving 130 patients, most of them critical care patients, from one building to another building, and then 100% occupying it and using it for the care, and then completely moving the surgical platform and the adult emergency department platform. You know, we worked on that planning and that move for a couple of years, and actually for the last several months before we took occupancy of the building and moved in, you know, our teams practiced using the space and the building.
Yeah, it's not just like wheeling some equipment over to the next building. I imagine that's a heavy lift you guys did there. But going back to the ribbon cutting facility, you said at the time, quote, "We will be able to treat more New Mexicans here in New Mexico, accepting more patients, reducing out-of-state transfers, keeping families together when it matters the most." So it sort of ties into what the governor said during that event, referring back to COVID and speaking of UNM. She said, quote, "We flew a patient an hour to Albuquerque. Those patients came to UNM. This wasn't open. We were serving patients in the hallways." So tell us just why the critical care tower matters so much in terms of healthcare investments, especially where we're seeing, you know, where we're at now.
Yeah, so when we moved into the building, that was an opportunity for us to immediately occupy 24 more critical care beds. So the tower has 96 critical care beds in it, but so that starts us down a pathway of continued growth. So we'll ultimately be able to open up another 72 adult inpatient beds, and then at some point we'll be able to build out another 96 beds in the critical care tower in our top 2 floors, so that we'll ultimately get almost 200 more hospital beds, you know, through this critical care tower. And then we will refurbish the old operating room space, which should give us another 10 operating rooms. So what that really does is it gives us more inpatient capacity. And so that's really what that kind of statement was about, is that the rate limiting step for us was we didn't have enough facilities to always accept patients that we could care for because we didn't have space. So this creates space for us to be able to care for them. Now, why that's so important to New Mexico is that when we think about healthcare infrastructure, or I think about healthcare infrastructure, hospital beds are one way to kind of measure that. And so when we compare ourselves with the number of hospital beds that we have in our state relative to other states, we're about 30% below the national average. That really makes a big difference in terms of access to care.
Yeah. And hearkening back to, you know, our reference back to the pandemic, I think that's when, you know, Chris and I and a lot of people in the public were paying attention to statistics like this, like hospital beds available. I remember that being a data point that we were all paying attention to in the newsroom. Do you think that COVID showed New Mexico kind of what it needed to invest more as far as healthcare facilities? You mentioned we're kind of behind the 8 ball as far as national scope.
Well, I think COVID really helped the general public become aware of the availability of hospital beds and kind of that transition of medicine. I think people who are in the healthcare business have known this for some time. And I think that the other thing that really happened out of COVID was we were able to kind of demonstrate that the hospitals and the health systems in the state of New Mexico actually have a really high level of cooperation. And I think that gets back to one of the earlier comments I made about the university being a part of everyone's healthcare delivery system. Right. It's a much more collaborative kind of approach to how we deliver healthcare than I think many people may have realized.
So, and by that you mean like it's less siloed, like Presbyterian and UNMH and Lovelace, you guys all kind of have a relationship.
We do. We actually do have a relationship, and in fact, as a state's academic medical center where we provide, the tertiary and quaternary care, we do take care of patients that come from Lovelace and from Presbyterian and Christus St. Vincent's, and in many ways we share programs with them and share providers so that we can improve access to care.
Part of opening the critical care tower is expanding existing services, I think, as you've mentioned a little bit here, by moving the bulk of old services that may have been sort of jammed in the old buildings into a new building where there can be more of those services. But that also leads me to think about what happens to the old space and, say, the Pavilion building, those places that were vacated, so to speak, and put now into the critical care tower. Have you started to revamp or fill in maybe some of the older spaces that is no longer used and is all sort of service-wise in the critical care tower?
Yeah, absolutely. So actually almost the day after we took occupancy and started using those critical care beds, we started the renovation of the old space because we want to make that space contemporary, and that'll be a really important part of our access to care. So some examples of that are the old adult emergency department, which moved over. That lets us expand our pediatric emergency department.
Okay.
We moved out of the old ORs and into brand new, contemporary, state-of-the-art operating rooms. So we are almost immediately started renovating the old ORs to be able to accommodate, the kinds of care and surgery that we could do in that space. Oh, and then ultimately, the 72 critical care beds that we moved over into the new tower, those will all become adult inpatient beds.
Okay.
So it'll all still be used.
Every bit of that's going to be used.
Yeah.
Okay. Is that all done yet?
No.
Okay. So got some time.
This is a multi-year project for us. I think about moving into the critical care tower was a really important milestone, but in many ways it's like the first really big step. The next big thing that has to happen is the old ORs get remodeled, and so that's underway. Another really big step is the 72 critical care beds get refurbished and made appropriate for med-surg or progressive care. The old adult ER space continues to be renovated for additional clinic space. And then ultimately, the top 2 floors get built out with another 96 beds.
Oh. So we did an entire episode, I will say, on the critical care tower, all the ins and outs over the last, I think last year actually, well ahead of its opening. I encourage our viewers or listeners to go back, take a listen to that and get that kind of full skinny. But just to wrap up on the critical care tower, Dr. Richards, is there something that you are most proud of that facility or most excited for maybe to come?
Well, I think the teams that designed and built that building did a spectacular job. And like we said, it's going to create access to care that's much needed for New Mexico. But what I'm most excited about is that patient care and that new patient volume, it really sets the stage for us to do other things as the academic medical center. And that is to now think about growing our educational programs and taking advantage of that new clinical space and the new volume of patients that we're managing.
We'll be right back with more of the New Mexico News Insiders.
KRQE News 13 investigations. One of the biggest cons in New Mexico history. How did they get away with it?
Well, they had an accomplice. The state of New Mexico.
A road rage encounter leads to murder.
I miss him every single day.
Did the judicial system fail here?
New Mexico's families, homes, and lives are left in ashes.
There's a level of anxiety.
FEMA has been an abject and abysmal failure.
Watch anytime on krqe.com or our YouTube channel.
So we're also seeing other clinical expansions. Let's start with the Truman Health Clinic. As we understand, this new 28,000 square foot, $18 million building is replacing an existing facility near Lomas and I-25. The new building will be in the South Campus area on University near Gibson, near that Southeast Stadium district. What is this facility's purpose and why choose this one as one of the next up investments?
Well, the Truman Clinic is really one of those special things that we do at the University of New Mexico, and it's part of a program, federal program called the Ryan White Program, and it provides primary care, but it also specializes in providing care for people living with HIV and hepatitis C, and it's a place where we can really ensure that patient population has a welcoming, great place to get care that's connected to the things that are unique to that group, like the specialty pharmacy services that get provided. So we're going to probably see like 3,000, unique patients a year there, but probably something close to 70 or 75,000 prescription refills, for individuals living with those diseases, and that matters.
Yeah. Compared to like what kind of numbers are we turning out now?
Well, so the volume will go up some in that group, but really what is happening right now is that they're in very old space that's kind of broken up into multiple sites. So this will give them one place to be able to receive that care, and that's important because the providers are really the backbone of what we do, but having healing spaces which show that we value and care about these patients and the families, that's one of the things that we'll be able to do in this new modern clinic space for Truman.
Is it under construction, or when does it start and when will it be done?
It's under construction, and it's near the corner of University and Gibson. Yep. And so if you drive by that part on, say, to a Lobo football game, you'll see that building, and we'll be in it in about a year with seeing patients.
And then the old facility, still have decisions to be made on that one?
No, I don't think we're going to keep using the old facility. That's a rented space.
Okay.
I think we'll turn that back to the landlord.
Yeah.
Okay.
All right. That's fair enough. Another clinic near Gibson, but on the opposite side of town, on the West Mesa, the Southwest Mesa, that's the future Sandia Vista Primary Care Clinic. As I understand, this will cover roughly 7 acres, 22 exam rooms, primarily serving non-emergency health services. It does not sound like this is a replacement facility, but rather an expansion to maybe an underserved area of town.
Yeah, that's exactly right, Chris. This is a brand new clinic, and it's a primary care clinic. And so this will mean that we can now increase the number of patients and families that will be able to get primary care. Probably close to 6,000 or 7,000 new patients will be able to get service there. And, our goal is to put these kinds of clinics, the primary care clinics, to put them in the communities. That increases the access and convenience for them. It'll also be an educational site for healthcare professionals who are training in primary care, but this is an expansion.
Right on.
Chris and I know how difficult it is when you're new to a state or new to a city and trying to find a primary care physician.
Indeed.
I think we've both been on the wait list.
Yes, yes, I was on a wait list for about a year, but eventually got in, and hey, we're locked in.
It takes
now,
a while.
so.
We need more of these places. So
Absolutely.
What's the funding situation for that project, and when might that break ground, the Sandia Vista Primary Care Clinic?
Yeah, so we're not, we are using our existing funds for that project. And so we're not awaiting any capital appropriation from the state, and it's underway. And like I said, about a year or so, we'll be in that clinic and up with operations.
Okay. So another clinic build out that we've heard about, this one's made national headlines, is a new women's reproductive health clinic in southern New Mexico, or moving down in the state. It's an investment the governor championed in the face of the U.S. Supreme Court overturning guaranteed abortion rights in the U.S. We understand there was a groundbreaking last year in Doña Ana County. What's the status of that project, and will UNM operate that in partnership with another group?
Well, that clinic, that reproductive health clinic in Las Cruces, is well underway, and we believe that we're about ready to start the actual physical construction of the building here in the next couple of months, and that we're on target to have that building up and running and seeing patients by about December of 2026.
Okay.
So a little more than a year.
Okay.
And yes, so we do that project in partnership with Planned Parenthood of Rocky Mountain and with Bold Families and Strong Futures are the 3 other partners that are with us in that project to be able to ensure that there's women's health and reproductive services in that part of the state.
Have we seen sort of an increase in demand since this Supreme Court decision in New Mexico? Are people coming here for that sort of care?
Yeah, absolutely. And so we've certainly seen a really sharp increase in the number of individuals, especially from Texas, women that have seeking health care in our state. And that was, in fact, one of the reasons why we're making sure that there's capacity in that part of New Mexico.
One of the last big projects to bring it back here to Albuquerque, at least one of the last big projects on our radar, I should say, something addressing the teaching side of the health system. This is UNM School of Medicine planning for a new School of Medicine itself at the corner of Lomas and University. Seems like a big deal. This would be a replacement, as we understand, for the almost 6-decade-old Fitz Hall on main campus. What's the plan for this new School of Medicine? How does it differ from the facilities that are at the critical care tower? Because I imagine maybe this school is more of the teaching space, not the, on-the-job teaching part of it, but the classroom teaching space, perhaps.
Yeah, so that's exactly right. So we are now working on and with the state building a replacement facility for the main UNM School of Medicine building. As you pointed out, Fitz Hall, which is that main educational and research building which supports our School of Medicine, built in the 1960s, and a lot's changed since then. What we need for classroom spaces and what we need to support the science, it's very different in a contemporary School of Medicine building. And Fitz Hall was built using some construction methodology of the time that really don't make it amenable to renovation or remediation or expansion. So we are looking to replace it.
And what's the status of that project? It seems like it's in the relatively early stages, with perhaps an architect recently hired to design that building. Is that right? And is all the money there?
So you're exactly right. So we're in the design phase right now. And so what we're hoping to see in this upcoming legislative session is the capital appropriation to begin the construction, which we could do late winter, early spring. That project could get completed by the summer of 2029, with the class being able to occupy the buildings then. And so we could see the first expanded medical school class graduating from that new facility in 2034.
Wow, okay. I want to acknowledge the brain drain discussion that we hear so much about living in New Mexico. Notably, we have an aging population in the state. New Mexico, especially in the fields of science and medicine, is considered a great place to learn, a great place where careers start, but perhaps not so much a place where doctors, especially specialists, are staying or being drawn to. How do you think this new School of Medicine building, gets at that issue? And do you see it having a statewide impact?
Yeah, so this building really is about the state of New Mexico because it's going to be the new home for the School of Medicine. But ultimately what that physical plan allows us to do is to double the size of the medical school class. Those are individuals who are getting their MD degree. But the School of Medicine is also the home of most of our allied health professional training programs, with the exception of nursing, college of pharmacy, and population health. Those have separate colleges, but all the other health professionals like physical therapy, occupational therapy, EMS, they're actually in the School of Medicine. So this new facility will let us double the size of those training programs also.
Okay. Do you see it as something that could kind of keep those students in New Mexico also, this whole expansion?
Well, what we hope is that as we increase the size of those training programs, that those individuals will stay and work in New Mexico. And we do track where individuals go after they graduate from our programs. And we know that those allied health professionals, about 90% of them stay and work in our communities. And so we're also growing, not just the undergraduate medical education program, but the new critical care tower also lets us grow the graduate medical education program. And that's the internship and fellowship periods, residency periods of medical education that occurs after you graduate. Those are like 3 to 7 years. And so we're continuing to grow those too. We know that individuals who train in a particular location at that period of their life are more likely to stay. So that we also are optimistic will help us address some of the workforce shortage.
Okay. And this dovetails into a big ask this upcoming legislative session, right? You guys are asking the state to help fund the $600 million School of Medicine. How much help do you need from the state?
Well, we really need this state to help us with almost the whole entire project. Mm-hmm. So if we think a little bit about the story that we have here, we started talking about the critical care tower. So we were able to build the critical care tower using our clinical revenues. Mm-hmm. So that lets us create the access to care and take care of more patients, but also then lets us be able to expand the number of faculty who would work like in the School of Medicine because they work in the new hospital. And so that's the big part that we bring to the table. Now what we don't have is the kind of clinical revenue to support the educational building, and so that's why we need the state to help us with that. But it does all fit together because over the last 10 or 15 years, we haven't had a big change in the size of the clinical delivery system. And so we've essentially put as many learners as we could in the old delivery system, but this new critical care tower and all the other projects that we just talked about mean that we can now start to grow these educational programs. That's why we can set this really big and ambitious target of doubling the number of healthcare professionals we graduate from the University of New Mexico Health Sciences Center over the next 10 years. So we think it's a great investment for the state of New Mexico, and that it will, help us address not only just a workforce shortage, but be able to do it across the entire state.
I know this project certainly ties into one of the initiatives that's come out of UNM. This is the Healthcare Workforce Expansion Initiative. Can you tell me basically what is the initiative? What's the overall goal here?
Yeah, like I said, the goal that we set is let's double the number of graduates from our health professional programs. Mm-hmm. And that matches up because over the next 10 years, we almost double the size of our clinical delivery system, starting with those multiple phases of growing out the critical care tower and those community clinics. And the reason why that's so important is that healthcare professionals require clinical experience as part of their training. So the new medical school facility is super important because it's that place where healthcare professionals get that classroom and didactic, and they get the lab experience, but ultimately they have to go into the clinical environment to be able to complete their training. So now with this expanding of clinical access, it creates the opportunity for us to grow these educational programs, and we want to match those two things up.
Yeah. I know we talked a lot about, just healthcare burnout, post 2020. Is it still difficult to recruit people into the profession, you think, or what kind of sentiment are you feeling from like those graduates in the profession who are interested in going into healthcare? Well,
healthcare is hard, and it's been especially hard since COVID. That's not just a New Mexico issue. That's a national issue. The demands on our healthcare professionals, they increase almost every day. We've got, changing policy environments where, healthcare delivery systems are operating, under increasing amounts of pressure. Patients are getting more complex, and in our case in New Mexico, older, which means more complex care. So we appreciate that it's a really difficult and demanding profession. But what we also know is that there's still a lot of people who want to become healthcare professionals. And so our goal was to try and give them the opportunity to be able to do that.
What would be your message to people who think they might be interested in the profession? What's your sell for the profession?
Yeah, I've got a couple of things that I feel really pretty strongly about. You asked me, why did I stay at New Mexico? And so one of the reasons I've stayed here at the University of New Mexico and in this state is because I don't believe that there's anything that we offer up that's more consistent and more reproducible to change the life of an individual or a family or a community than to give someone an educational opportunity. And when you can do that and also make them a healthcare professional And you can offer that up to someone who might be from a rural community in New Mexico who may go back and deliver essential services. That's really powerful. And so that's what I hope we're going to be able to do with expanding these educational programs. So what I would say to all of the folks who are out there who are saying, could this be for me? The answer is yes, it could be for you. These are great jobs. They're in much in demand. They actually compensate well, and they're a great way to have a career.
Yeah.
And it sounds like rewarding from what you're explaining.
Certainly.
Full circle, do all these investments we've talked about better poise New Mexico to be ready, in the next medical crisis, another pandemic? What's left? Do you feel confident that we have the infrastructure and the workforce for another medical crisis?
Well, how about this? Disasters and medical crisis, by definition, are periods of time when the demand exceeds the capacity.
True.
So, and part of it is knowing how to use the resources you have to make sure that you get the best outcome. So there's really not a finish line on that. And we've got a lot of need in New Mexico, and we've got an aging population. So I don't see the end in sight, but I see a lot of very significant and very important progress towards increasing the access to care and increasing our ability to train healthcare professionals. So I'm back to New Mexico's a special place, and this is a great place to be. It's a great place to be a healthcare professional. I know that that's not always the message that gets delivered, but that's the other thing that I would say. This actually is an important state to be able to do this kind of service, and like I said, I hope that we can offer it up to a lot of New Mexicans to be able to take advantage of that.
Right on. Well, is there anything else that you would like to add or want people to better understand?
Well, what I would like for folks to understand is that we are committed to doing this, and that we're committed to increasing the access to care. I mean, just like when we talk to our healthcare professionals, we understand that it's a really tough environment right now. But we also know that it's really tough to be a patient right now, too, because we don't have all the access to care that folks would need. And that can be frustrating, and it can be discouraging to have to deal with a very complex medical system. We understand that. I appreciate those challenges. We're committed to making that better.
Okay. Well, Dr. Richards, thank you so much for joining us. We appreciate it.
Thank you. It's been great to be here with you today.
Again, a special thanks to Dr. Michael Richards for joining us from the UNM Health System to talk about everything that is up in front of them. It is a lot when you think about it. Just, I think he was talking about after we had recorded about $1 billion worth of investments that were happening, and he could see the next billion.
Yeah, billion with a B. This is a lot of money being invested into what is clearly a critical need for New Mexico. I mean, it sounds like, the demand is high, not only here in the metro, but across the state. We have rural communities who, come to Albuquerque a lot of times for their health care. So it really does impact a wide range of people. We appreciate him coming on. If you got any story ideas or people you'd like to hear from on our show, always feel free and reach out. I'm Gabrielle.Burkhart@krqe.com via email, and GBurkNM on social media.
I'm at Chris McKee TV, also Chris.McKee at krqe.com. Thanks for watching and listening.